Okay, so one of the big concerns after gastric bypass, particularly the Roux-en-Y gastric bypass, but also mini-gastric bypass, is when you cut the bowel and bring it up to make a Roux-en-Y, or when you bring up the loop, is that the gut can slide in and out through the hole that's made and cause a bowel blockage or a twist or a blockage. Okay? So you might wonder how many people of the MGB have gotten bowel blockage from that internal hernia out of the 6,000 roughly patients we've done. As far as we know, 0. How many Roux-en-Y patients of the hundreds of thousands? Some people have reported up to 10%. So if we had done Roux-en-Ys in 6,000 patients, 10% of 6,000 would be 600. So it is true, your doctor, the little grumpy man that he was, is true, you could get a bowel blockage from the surgery. You could. We haven't seen it.
Yeah.
If you had a Roux-en-Y, the chance from some studies up to 10%.
Yeah, he was talking about he was going to try to close that up, and then he's like, well, I was going to, and then I thought it might make a smaller one, so I decided to leave it. And I'm like, thank you, don't mess with my MGB.
Right. So our data is, and we had there are people who have concerns about the MGB, and since I'm the one doing it, people say, well, you're saying good things just because you do it. And now we've got people from Taiwan, Mexico, Colombia, Germany, England, France, Italy, Spain, Sicily, Lebanon, Israel, Turkey, Australia, Taiwan, and all around the world that basically found the same kinds of things that I have. So that the worries that they had, things like this, that you're going to get bowel obstruction, just haven't panned out. It's okay to worry about them, but he should be more worried about his Roux-en-Y patients than our MGB patients as far as bowel obstruction, internal hernias.
Right.
And we don't close that great big hole because that loop, just like he showed at the surgery, can slide in and out, and it's no big deal. It happens all the time, and we have not seen any bowel blockage, whereas Roux-en-Y doctors, I can tell you here at this hospital, the general surgeons see emergency Roux-en-Y bowel blockages every couple of months. And so it's very common here in town. Yeah?
What does a bowel blockage feel like?
Severe abdominal pain, cramping, dilation, swelling of the stomach with nausea and vomiting.
So when you look at this, I mean, like, because he said he did kind of move the intestine around and stuff, and then after I had my gallbladder surgery, after I ate after that, I got like popping, it felt like, and like things just didn't feel the same in my stomach when I ate. And it took it like 3 or 4 days before I guess it settled, so I was a little concerned. I'm like, what did he do?
No, it probably moves in and out like that all the time. That's
Okay.
the thing. The thing is, like he showed, it's just a great big space. What you're worried about, like he said, if he tried to close it and there's a tiny space, that's where it gets stuck, and then you get swelling and then blockage and
Right.
perforation.
That's what I
And
was
again, if you talk, you can call like our general surgeons who work here. They see that bowel blockage a dozen or more times a year here, and that we have zero MGBs. Okay.
Well, it's amazing. This doctor up in the Summerlin Hospital, I've heard of him. And then he says, I'm going to call a surgeon. I said, not to be rude, but I need to see my doctor and I need to get out of here. Because if you've never heard of it, what
Well-
the heck is this guy going to do?
Well, we actually, remember we have that in the permit. We have had, if you believe something and you see something, you kind of have a colored view of how it's going to turn out. So we know of patients where they went to a local Roux-en-Y doctor. The Roux-en-Y doctor said, you have nausea, vomiting, or belly pain, must be the MGB, and they've operated and give them a Roux-en-Y. And there's actually published an article on that, and they said the MGB was bugging them. And they said things like, you know, this and that, bile reflux, gastritis stuff.
Right.
We just haven't seen it. And patients who come to me, pretty easy to fix. Now, we have probably about a dozen patients who've been to a local doctor. The doctor did convert them to a Roux-en-Y because they thought it was a good thing. And now they want to go back to their MGB, and it's pretty tough to undo a Roux-en-Y. So.
Yeah.
So I'd like to just point out that it's important that you trust Dr. R and don't let the surgeons push you around for doctors if you can't come back here.
Yeah, I made it very clear to him that he had to wake me up and talk to me before he did any cutting because,
It's easy for him to make you feel like you made the wrong decision.
yeah, he
I
had
would
me
say.
in tears in his office.
Maybe we'll send him a follow-up letter. Okay, well, we're glad that you're doing all right and you